Good morning, everyone. It is Friday, November 10th. Welcome to the Morning Medical Update. Thank you for joining us here on Facebook and on YouTube. So we want to show you this graph. Take a look. This is the latest trend showing how COVID-19 cases are once again on the rise here in the metro. As you can see, the trend right now shows we are heading back into numbers that we have not seen since August. And early signs show that this trend is not going to slow down anytime soon. So make sure you get your questions sent in to us on YouTube, Facebook, and you can email those to the Medical News Network. Find links right there on your screen. We're going to turn now to Medical Director of Infection Prevention and Control, Dr. Hawkinson. He's joining us. Any new news on the numbers?
Numbers are holding steady, 35 active infections, 7 in the ICU, 6 on the ventilator. A total of 2 of those 35 active infections are vaccinated. One is in an ICU, but this positive test was found on an admission screen. They were not here for COVID itself. Also, 27 additional patients in that recovery period, so a total of 62. And then we did have our last death on December 9th as well. So still causing quite a bit of mortality.
All right. Thanks for the update. Let's check and see if we have any reporters on the line today. We're clear? All right. Okay. Again, we're going to get to your questions here in just a moment. But first, a sitting duck. That is how our guest today describes living here in the metro with the Omicron COVID-19 variant swirling around. This is a look at the current COVID cases across the country. Dr. Amber Schmidtke is with us today. She is the chair of the Division of Natural Science and Mathematics at the University of St. Mary's. She's our numbers lady. She's going to break it down. And she wrote in her national publication, quote, "I live near the northeast corner of Kansas, right in the thick of it. I can tell you that most people here are living their best lives, clearly ready to get this pandemic behind them. But the life is divorced from reality, is what you say. And you say that we are a sitting duck. Tell us what you mean by that. That sounds pretty scary. That's not a position we want to be in."
Certainly not. And it's nothing that I enjoy joking about, certainly. But I think that honestly, it's a lot of frustration, walking around. I want to sort of show everybody that graph that you opened with. This is where we are. And like I said, people seem to either not be aware of the fact that that's happening or perhaps don't care. And so is it an issue of we need to make sure that we're spreading the word that things really are getting intense, or will it take, being in the headlines because hospitals are full and unable to treat patients the way that they want to treat them?
So is this a full sounding of the alarm?
I think we really should be very concerned because right now we know that Omicron is in all of the states that surround us. It hasn't fully been identified in the state of Kansas, but there's no reason to suspect that it isn't here. But in the meantime, we really already have our hands full with Delta.
Is this the graph you're talking about?
This is one of the graphs.
What are we seeing, and what do you really want us to pay attention to
So what
here?
I want us to see over here on the left in the red graph, you can see that, we're seeing that straight up vertical line, and that's really scary. That's what looks like exponential growth of cases. And, just because those are cases doesn't necessarily mean that those are translating into hospitalizations. But it's concerning to see that rising the way that it is. We're already seeing more cases than we were previously with the Delta surge that happened this summer. And this is already, we're seeing the Thanksgiving sort of effect at this point.
Right.
So if you want, I'll show you on my next slide. You can see some of the genomic data that we have for the strains that are circulating in Kansas, and in terms of what have they been identified as in terms of the variants. 98% of the strains that have been sequenced from the state of Kansas are the Delta variant in dark blue, but it's hard to see, but there is that tiny little sliver of gray, and that is an unassigned lineage. There's 2% for this for Kansas and 3% for Missouri. The only thing that can really compete with Delta right now is Omicron, but CDC has not started to include Omicron in their weekly surveillance. So it's a question of, do we already have Omicron here? That's just something that we'll have to wait and see for their next weekly report. So if we move on to the next slide, forgive me, what you'll notice is that on the top, we're looking at cases by region, new case rate by region. And what you can see is that cases are rising very quickly for the Midwest, who leads the nation, and the Northeast. However, if you look at that graph on the bottom, that is looking at COVID admissions. And so even though the Midwest and the Northeast are really held together when it comes to cases, there is a very big difference when it comes to hospital admissions. And that has a lot to do with the fact that the Northeast region has higher vaccination rates generally than the Midwest. And so if we go to the next slide, I'll show you what I mean. This map shows you how the Federal Emergency Management Agency breaks up the United States into regions. And this is how the Department of Health and Human Services also evaluates the data for COVID. And so what you can see here, if you look on that chart to the right, you'll see that Region 1 has the highest vaccination rate. Region 1 is that Northeast space, and their vaccination rate is 72%, and New England is right there with them at 69.5%. If you look at where we are Region 7, we're second from the bottom. And so we have a vaccination rate of about 55%, and the regions that surround us are right there with us as well. And so as we look at how cases are rising in certain areas, this may explain why the Northeast is not experiencing the run on hospitalizations that the Midwest is at this point. Now, if we turn to the Kansas City metro, we've seen an 84% increase in case rate over the past 14 days, which is pretty alarming. And like I said, about 55% of our total population is fully vaccinated. And thankfully, 85% of adults who are 65 and older are fully vaccinated. And that's important because they're some of our most vulnerable members of our population. One thing I wanted to highlight on the right over here, what you're looking at, is that for all age groups, test positivity is well above 5%. The goal is to always be at or below 5% for as long as we can. Test positivity is a way to measure, are we testing enough? And so when we have test positivity that is higher than 5%, that means that we're more likely to be missing cases. And so what you can see here is that on both the Kansas as well as the Missouri side of the river, we are probably undercounting cases by a large margin. And so the danger in that is that you can't see how big the problem is, which makes it harder to control. And I think that's really kind of where I want to stop for now and talk to you about what all this means.
All right. Yeah, I do want to know what it means, because are we assuming that the higher numbers is because of Omicron, or you're saying we don't know that? And does that matter?
In a way, it doesn't matter. You know, I assume when Dr. Hawkinson and his colleagues treat patients, they're not stopping to check whether it's Delta or Omicron. They're dealing with COVID. And really what this is going to matter most for at this time is transmissibility, is what we're, at least in the early data, that's one of the things we're most worried about, is that Omicron may spread faster than Delta, but we'll just have to see.
And Dr. Hawkinson, I was listening to some news this morning saying that, and just tell me and update us on what we know about Omicron, but that it might be more transmissible, but the symptoms might be more mild. Is that truth? Help us break down the difference.
I think it's really too early to tell. I think there are a lot of caveats to that early information, especially out of South Africa. So the other issue with South Africa is they don't have a high vaccination rate. There has been a lot of spread in South Africa. So is this reduced intensity or reduced severity because of previous infection with Delta? Is that part of the immune system working? I don't know. These are caveats that we just don't know and understand it. So I think it's really too early to tell about the true severity of Omicron. So that's one thing to consider. Also, when somebody comes in with COVID-19, we have no way of knowing which variant that is. We have to assume what variant it is by the current epidemiologic data and the sequencing, which is, again, done at the state level, but it really doesn't matter for treatment purposes. So I think that's understanding. What we do know about the virus is there are a lot of mutations or amino acid substitutions in those proteins of the virus. And so, but how does that interact? What is the biological relevance and clinical relevance of all that? We are still learning to do that, learning to understand that. The increased transmissibility is really a nebulous term, so I think we really have to get down and understand, what does that mean? Is it more fit? Does it bind to our receptors easier and tighter? Does fewer particles then, because of that, cause more infection? Are you able to replicate more so that when you express it to the environment, there's more viral particles in the environment? So that is kind of a nebulous concept that has continued to be promoted really since early in the pandemic, when we start seeing the new variants as far as it's more transmissible. I think we really have to get down and understand what that means. But is it more fit? Can it outcompete Delta? Again, these are questions we still need to find answers to.
COVID is COVID.
COVID is COVID.
So, Dr. Schmidtke, and we already have one of our listeners and viewers asking where they can get your slides. So they are very helpful. So we'll figure out a way to get those, because they'd like to share those and credit you for them and help break that down. So we appreciate that information. But tell us, when we see these slides and people go back and look at them, what does this overall trend mean on the big picture? You said we're seeing the Thanksgiving effect. Now we're going to see the big holiday effect, first of the year. Where do you see this heading?
Yeah, it's really concerning when we know that what the sequence is coming up, right? We just went through Thanksgiving, and I hope it was wonderful for everybody. But we're running right into Christmas and all of the busy activities that happen between Thanksgiving and Christmas. And so the concern is that people are picking up disease, maybe without realizing it, going to these family gatherings, and then possibly spreading it to others. And then, of course, New Year's is a week after Christmas. And so, again, people that go to Christmas gatherings and pick up disease may not be symptomatic before they go to New Year's Eve celebrations. And so we went through this last year too, where it's a very unfortunate sequence of events.
Yeah.
In terms
Double,
of
triple
spreading
punch.
disease. Yeah.
Real quick, because I'm going to sift through some of these questions, and our viewers are asking some good ones this morning, so we're going to get to those. But while I'm doing that, tell everyone about I call it your blog, you call it your newsletter. Sure. Tell everyone about that and where they can find that information. It's so great.
Sure. So it's called the COVID Digest. The URL is amberschmidtkephd.substack.com. And what this is a newsletter that goes out weekly at this point. And I am writing about the different trends that exist on a national level, but because I come from the South, I do spend probably an extra bit of focus on the state of Georgia, where I came from. And so that's really kind of how that is. It has about 30,000 subscribers. And so it has a pretty good readership, which is why I think I am noticed by folks like you.
Right, because what you're learning from state to state travels this way, and we're able to learn from the information you're gathering. Let's just jump into some community questions if we can, and then we'll get to some follow-up questions in just a moment. But Lindell is asking, I feel the news is burying the news on COVID these days. Why do you think it is not a headline? The hospitals are desperate, but the news is not covering it the way Lindell feels it should be. And I want to ask you just about that, and then Dr. Hawkinson about just hospitals and capacity. I'll let you start.
Yeah, there's a lot of news going on right now, and so it's competing for airtime against those sorts of things. But I think that a lot of our problems stem from a pandemic that has not been controlled, and so in many ways, you do wish that we were getting more attention paid to this. We are seeing more news coverage coming out of places like, Michigan, where they are running out of hospital beds, and Massachusetts too. Even with a higher vaccination rate, they're having some struggles getting people into hospital beds who need them, whether they have COVID or not. And so I think that those are the more compelling stories. Those are the things that tend to get people to move, that get them to take action. But we aren't seeing that here, and I don't want that to happen.
I was going to say, we don't want to make the headlines, Dr. Hawkinson, because that's it. I mean, once we start making the headlines that we're running out of hospital beds, that's not where we want to head, right?
Yeah, I mean, I think there is an aspect of COVID weariness syndrome, the cows that Dr. Stites refers to. There are also other things, but there is still a lot of COVID information and stories, but I think there's also a lot of those stories not only having to deal with the capacity issues we see on CNN today. One of the top lead stories is certainly the Michigan issues, the unvaccinated, but we also have to understand there's a lot of political information and concepts wrapped up in this as well. We do see a lot of stories about further measures to reduce public health mitigation strategies and things of that nature. So, it is out there, but I think there are a variety of reasons why sometimes we don't get it all the time. I think everybody still does have a little bit of cows, but that's why it's so important that we continue to endorse the message of the pandemic. It is going on, but it is a pandemic of two populations now, the vaccinated and the unvaccinated. And if you want to save yourself individually and help your bubble and help your family and your community, please continue to get vaccinated. And if you need that booster, please go get that booster.
I want to get to our first follow-up question, if we can pull that up. And Dr. Hawkinson, you'll notice these questions are questions I think people were asking this time last year, but they're coming up again because people want to know, is life supposed to look like it was this time last year? Just let us know and we'll do it, hopefully. So the first question is, how can we eat indoors safely? Should we go back to carry out? And Isaac is asking, is it safe to go to movie theaters? Should I be wearing a mask? Assuming other people are masked or aren't, we don't know. So help us kind of go through those basics again.
Yeah, I think in that second question, that's a good point. You know, if you can go to areas, and especially indoor places where you know people are going to be masked, they really should be masked at movie theater. You're not really talking. Occasionally, I guess you're eating a little bit, but you're pretty much in a stable situation. You're not doing active exercise like in a workout class or anything like that. That's probably a lot safer if you can, especially if you can guarantee or see that a lot of people are wearing masks. The best thing you can do is go get that booster. We have very good articles published this week in the New England Journal of Medicine showing the reduction in cases and severity, especially for those people that did get boosted. And it really continues to boil down now to your individual tolerance of risk. Do you understand what is that situation you're going into? If it is a restaurant or a bar, you have to understand that there is probably COVID around that area, that everybody is not vaccinated. How comfortable are you with that risk? And so I think that's what it boils down to. If you have your eyes on the near future and you're going to be meeting with family members or gathering with them for the Christmas or the New Year season, understand that, well, maybe I need to reduce my risk factors and reduce going into those places where it could be higher risk of getting COVID. Certainly, one thing you can do is consider takeout again. But right now, again, there is no mandates, restrictions, or things like that. And so it really does boil down to everybody really understanding what their risk is, what their risk tolerance, and of course, strategies to help reduce those things with vaccination and those non-pharmaceutical interventions.
Use your personal good judgment. Deb has a comment, Dr. Schmidtke. No masks, people gathering indoors, and vaccination rates at what they are. How could we expect anything different? Fair to say?
Yeah, I mean, absolutely. I express the same sort of frustration at what's going on here. I'm not everybody's mom, though. I can't run around and tell them to put their masks on. It's really just we have to take care of ourselves and the people around us as much as we can. So again, I would just echo what Dr. Hawkinson was saying. Try to get that vaccine if you haven't already. If you are fully vaccinated and you're 6 months out from your most previous dose, make sure you get your booster. But again, this is a layered approach. So, you know, when cases are low, we can maybe get away with just being vaccinated and staying relatively distant. But when cases are high like they are right now, then we need to add additional layers. So things like wearing a mask, avoiding indoor gatherings if you don't know their vaccination status, avoiding crowds in general. And that's really hard to do at the holidays, right? Because we're all shopping for presents and getting together and that sort of thing. So, I think we all hoped that this Christmas would be different than the one last year. And in many ways it is. But we are not quite out of the woods yet.
Dr. Hawkinson, I know you've traveled from time to time through the pandemic. You've done it safely. Jackie wants to know, how safe is it to go on a cruise right now?
Yeah. As an infectious disease doctor, and I know a lot of people like cruises and have a good time, as an infectious disease doctor, I avoid them. How safe is it to go on a cruise? Besides the regular risks you run with cruises, such as those gastrointestinal infections, or if the engine breaks down and the ship gets a gastrointestinal infection that goes throughout the ship. I think cruise ships continue to be maybe higher risk. I've never been on one, but I think if you are not outside on one of the decks, then you are in those larger eating areas where people are eating. We know, every couple weeks we see that so many number of people on a cruise ship got diagnosed. I think you are just in such close quarters for a lot of the time on those ships for those purposes of maybe activities and or eating, that it is probably a little bit higher risk.
So we're not going to see you doing the limbo out on a ship deck anytime soon. Yeah, I've gone on a couple of cruises and they are fun, and I don't want, I get that. I know it just, you're right. We hear a lot of now with the news and social media and videos that people take on cruises when you're right, they break down, and there's some nightmare stories when people go on cruises. So it is like any traveling, traveling at your own risk. I know you and your family are going to be traveling because you all are vaccinated. you had actually put off a trip, right? And now you're planning to go again, and you took that very seriously.
Yeah, so we, our pandemic family and us, we got together in March when we were fully vaccinated, and we're riding that high of excitement, and we booked a trip to Hawaii. And we booked it for the week of Labor Day, thinking that by then, surely, that we would have pediatric vaccines for our kids. As we approached that deadline, of course, there were no pediatric vaccines, and cases were rising. In fact, so much so that the governor of Hawaii asked people not to come. So we postponed our travel to Christmas, hoping very much that the pediatric vaccines would be here. And yeah, we were sweating, really hoping to see those vaccines come out as quickly as possible. Thankfully, that has happened. Our youngest is fully vaccinated, same for the other family. And so, yeah, we are getting on that airplane in about a week. And we'll be just, it's so much less anxiety to get on that airplane at this point, knowing that our youngest is protected, that we are boosted. We'll still be wearing KN95 masks for the whole duration, but we will, of the flight, that is. But I am excited. I am excited to get out of town. This is the first airline travel we have done.
You deserve it, my friend. You deserve it.
Pandemic.
Dr. Hawkinson. Okay, so Mary and Janet have similar questions. How can Okay, I know we like to stay in our lane, but how can we get politicians to bring back the mask mandates?
Yeah.
Do they keep in touch with our doctors and other doctors to get advice? How do we work on that level with other folks in the community? What can you tell us?
I think it is just about continuing to engage those leaders. We know that there are other aspects of daily life that the leaders take into account. We really try to promote and endorse the optimal public health and medical advice, and that is supported by data. And however, there are other aspects that the leaders do take into account. There are a lot of voices on each side, and so I think it is very difficult. And unfortunately, then now we also have other say non-economic or medical aspects in that decision making. It's a lot of philosophy with the politics wrapped up in that. But I think we just have to continue to endorse really all of that data, that public health and medical science that is supported by accurate peer-reviewed data to support the best methods and the optimal methods for helping reduce the spread. So we know that's out there, and we know that a lot of the leaders do have medical advisors or medical advisory boards, but it's just a matter of what they prioritize in making those decisions, I think.
All you can be is the voice of science, I suppose. Okay, so our next follow-up question. I heard a third of known Omicron cases have been of those who are vaccinated. Now, Dr. Stites often says this is a pandemic of the unvaccinated now, but with that question, is this now a pandemic of the vaccinated too?
Yeah, I mean, again, I think that really, even when the vaccine was first rolled out, we saw that there was a reduction in the chance of testing positive, even if exposed. But that chance reduced, especially after that first 3 months after vaccination. The vaccination was never meant to protect you against testing positive or having a case. The vaccination was meant to protect you from going to the hospital, developing severe disease, and of course dying. We know that that continues to do that, and that is why we do say this is a pandemic of two populations. The vaccinated, which if you're vaccinated, and especially if you have your booster, your risk of going to the hospital, going to the ICU, and dying is reduced by 90% or more compared to those that are unvaccinated. And so there is that pandemic of two populations, the vaccinated versus the unvaccinated. And the vast majority of the people that are in the hospital now are unvaccinated. The vast majority of the people that do die are unvaccinated.
Dr. Schmidtke, follow-up question. If cases are going up, are they at least going up at a slower rate, and does that matter?
Well, I think the graph that I showed at the beginning tells us no. They are rising at a very fast rate.
Can we pull that up?
And that is concerning. The red graph is what I'm talking about. Yeah, I mean, so if we look at this, you can see that when the winter surge came for Kansas or the Kansas City area last time, we see this straight up line, and we see that straight up line once again now. So there really is no distinction between what COVID was doing to us last year as compared to now. We are starting from about the same footing. If you look at where we leveled off after the Delta surge of the summer, we leveled off at a level that was very similar to what we saw before the winter surge of 2020-2021 began. The question remains, is this going to go as high as the last time? Hopefully not, with as many people who are vaccinated. But it's really kind of no longer a question of if you're going to be infected with COVID-19, but really when we have variants like this that do seem to spread more easily than the original version of the virus that first came to the United States.
Dr. Hawkinson, Jennifer says, my child is in high school and is over 16, so we should now be able to get boosted, right?
Yeah.
So tell us a little bit about that, because that was just approved by the CDC officially yesterday. Tell us about that and help Jennifer out. What should she do next?
Yeah, so I think that was good. We did have a question yesterday about a parent who wanted their 16-year-old to have that booster. So I assume and believe they really need to be that 6 months out from their original vaccination. And we said, well, it's not approved yet. The fact is you could probably walk into any pharmacy at some point and get a dose. But we did expect it in some time. I said a week or 2 weeks, I believe, or maybe further. And luckily, though, however, 2 or 3 hours later, the FDA and CDC endorsed now vaccine boosters for those 16 and 17-year-olds. So anybody 16 and up now with Pfizer can get a booster. I don't believe that it is in the Moderna or the Johnson & Johnson EUA. So that can be done. Is it safe? Absolutely, I believe it's safe. All the data that we have across all age groups for boosters, for first shots, do show it's safe. There are risks associated with the vaccines, but the benefits of these vaccines far outweigh any of the risks, especially if people are concerned with that myocarditis. And it looks like those age groups, 19 to 24, 18 to 24, really seem to be in that highest risk of that myocarditis, which is self-limited. It does resolve, and it is much safer compared to the myocarditis you get if you get COVID-19 infection with the actual virus. So yes, it is safe, and all the data that we have really supports an improvement and a reduction in the chance of testing positive, especially in those first 3 months after the booster, and of course hospitalization, severe disease, and death even further out from that.
All right, another restaurant question, Dr. Hawkinson. People want to know, is it safe? So Isaac is asking, if you have to eat indoors, because we know patios are pretty much shut down, where is the safest spot to eat? Because I think you don't want people walking past you and all that good stuff. But where is it? I mean, I know you're not the architect of the restaurant industry, but maybe if you had to go out to a restaurant during these cold months, where would you be spotting a good place to sit?
Certainly, I know it is colder, but if there's an open window where you have the wind blowing in to blow the particles or the air movement away from you. I guess if you're near a vent where the air is blowing away from you, those probably are safer places. But I think it is hard to say, just like you said, Jess, to really understand the engineering and the air dynamics and flow in a restaurant.
But it makes me feel good to know that people are at least trying to figure this out. They want some voice of reason. I think if Dr. Hawkinson just said, just don't go eat, just go pick it up, they'd go, okay, sounds good, I'll do it. I think people are wanting to stay safe and stop the spread. Michelle wants to know if you could touch on how protected our younger kids are, 5 to 11. Mine just got their shots. Yours, I know all of our kids are shot up here in the studio. But we were looking at 90% coverage. Now we have Omicron. They won't be eligible for the boosters for another 6 months. So how protected are they during kind of this weird, waiting period?
I would say that, luckily we know that younger children in general have less of a chance of going to the hospital. They have less of a chance of developing significant symptoms. So that is already good. That's inherently in the virus and the infection itself. If your children have had the vaccine, right now they continue to be very safe and protected from those things like hospitalization and severe disease. So I think you're okay. If we are moving in the direction, and I think Israel is pretty proactive in moving in the direction of giving boosters to everybody who is eligible. If what we have seen from yesterday's question to a few hours later, the FDA and CDC approving the boosters for 16 to 17-year-olds, it probably is not going to be a very long time from that 5 to 15-year-old now that is still have had vaccines but not eligible for the boosters. It probably shouldn't be long from then. But I haven't also talked to Dr. Alt lately. I don't know what the committee will be discussing and when. But overall, with the children, luckily we know that with this infection, they are fairly well protected from that severe disease and death. It is very few, a smaller percentage of the children that have to go to the hospital, luckily, and die. So if they are vaccinated, they still are very well protected right now.
Billy wants to know if an unvaccinated person gets a second infection, is it the same or can the symptoms be worse?
So this is good. There is one or two small studies looking at reinfection, and really the results are variable, where some people will have no symptoms. Some people will have worse symptoms. There was a recent study, but again, very, very small. They looked at reinfection both with the same virus but also a different variant, and the results were heterogeneous. So the best thing, though, is if you have been infected, is to get vaccinated. Because, we did think, and there was a couple other studies that said, well, with reinfection, you certainly are less at risk of severe disease. But a recent one this week did show that almost half of those that had a reinfection did have a more severe course than the first time. The other half, almost half, had the same symptoms, and a smaller number did have no symptoms at all. So the results are really variable, and I think it will depend on that individual moving forward as well.
But I think what I hear you saying is get vaccinated.
Absolutely.
Most importantly.
Yeah.
Dr. Schmidtke, not to put you on the spot, but do you have any information on that age group 5 to 11 getting vaccinated, what that rate looks like, if not here in Georgia or anywhere in the country?
Nationally, it's picking up really fast, which is really exciting to see. I don't recall the numbers straight off the head.
Why do you think that is?
I think there were a lot of parents like us that were, tired of carrying around that anxiety and ready to just park that somewhere that where it wasn't serving them anymore. So I know that I was, one of the first at our local health department to get our son vaccinated, and I think that was true about a lot of health professionals and people who have been, following the pandemic, who may not be scientists. There's a lot of people that just wanted that peace of mind. And so right now we're seeing a lot of those first kids that got vaccinated get their booster, or not their booster, their second dose. And so that is also contributing to higher numbers. And what's interesting actually is that age group is the biggest age group right now when it comes to who's getting vaccinated across the entire population. If we look nationally, it is the 5 to 11s that are leading the way in terms of vaccinations. So that's really, really encouraging.
That's good. That says a lot about the kids and about the parents. And I don't know our viewers, you remember Russell, who got very excited when he had his first shot? Dr. Hawkinson, you remember him, right?
Yeah, absolutely.
So he's getting his second shot. So hang tight. We've got a really great video. Oh, are we going to pull that video now? Let's take a look.
Let me get your Band-Aid on this. Don't want to get any blood on your Chiefs jersey. There we go.
Okay, you're done, bud.
Wait for it. Wait for it. He's going to bust a move any minute. Russell, buddy, we're so proud of you. Love you. Love your energy. It's exciting to see people getting that excited. I never know if my kids have ever been that excited to get a shot, but I love Russell leading the way. It's good news, very good news. So, Russell, thank you for doing that. Love that video. Yeah. Okay, kid. So a couple more questions. I got to follow up one, Dr. Hawkinson. Is it safe to mix and match the booster shots? Safe to mix and match?
It is. If you've had an mRNA platform vaccine, which is Pfizer or Moderna, you should really stick with those. That is okay. There's no reason to switch between those. They are essentially the same. If you've had a Johnson & Johnson vaccine as your initial, really the recommendation is to stay with Johnson & Johnson, but I think a lot of expert opinion are giving that second dose as one of those mRNA platform vaccines.
I'm going to skip to question 6, guys. A woman was asking, I received my flu shot a little earlier in the season. I know you talk a lot about timing of the flu shot, Dr. Hawkinson. Should I get another one? Do people need to get another one to get better protection?
Right now, there is no specific recommendation to get that second dose of influenza vaccine for most patients. There are some expert opinion for certain populations. Most of the time when we're talking about that for COVID vaccination or for influenza, obviously our viewers know that's that immune suppressed population. But again, no other specific recommendation for most people to get a second dose of the influenza vaccine.
All right, Kathy wants to know, seen an uptick in cases in Southwest Missouri classroom. What is going on in the KC area as far as schools go? Have you heard, because I know I'm getting calls from some of my kids' classmates' parents saying, yeah, it's kind of creeping in. It's kind of going around. What are we hearing? I mean, kids have been keeping their masks on, and we have at least some of them vaccinated. Any insight into that?
I don't have any specific insight to what's going on with the Kansas City schools. I'll just say that first and foremost. But what I will say is that disease doesn't pay attention to boundaries like the doors of the school. And so when we have high case rates in the community, eventually that's going to find its way inside of the school building. And so ideally, if we want to keep schools open, and I think we all do, we need to be doing our part to limit disease outside of the building with those layered strategy approaches. And especially as, we talked about how many 5 to 11-year-olds are getting vaccinated. That's, it's exciting, but we still haven't vaccinated enough of that population to create a protective bubble inside of that school. So I think that we still need to be very careful about what are we doing to prevent that disease from entering the building.
Jane wants to know, what's the level of protection for a kid a week after Dr. Hawkins said their second vaccine? So they're fully vaccinated, week later, are they safe?
You're certainly safer than before that second vaccine dose. It's not optimal, it's not the maximal immunity, but you do start getting that boosted immune response after that second dose fairly quickly, but still maximal protection would be considered 2 weeks afterward. We know that in some of the booster studies, again, so this would be the third dose, not the second dose, but they actually looked within that short time period prior to that 2 weeks after that third dose compared to after the 2 weeks after that third dose. And the protection was a little bit better after that 2 weeks. So you do start to get that boost or that increase in immunity both in B cells and T cells after that second dose fairly quickly, but you would still not be considered optimally or maximally protected until that 2 weeks.
Okay.
But yeah, you're going to have a benefit.
Okay, there's something there. So Sharon wants to know, if you're 13, had COVID a year ago, and then have taken 2 Pfizer vaccines, are you going to need a booster? And then my question is, why are people so concerned about whether they need a booster or not? Don't you just go get a booster? Is it just not wanting to go get a shot?
Yeah.
Or are people concerned about getting the booster or needing a booster?
I think clinically there are questions there. Do I need it? And what we have seen from this very early publications, especially this week in the New England Journal of Medicine, about that Israeli data is that across all age groups, that third dose does protect against, number one, testing positive at all for the infection, but also hospitalization, severe disease, especially in that first few months, as compared to those people who did not get that booster. So, but if you've had the infection, and this is what we are seeing more and more, if you've had the infection and then you got vaccinated, you probably have better immunity because you, number one, had the infection. So you also got to develop that immune response to all of the other proteins on the virus. With the vaccines, you start to boost that spike immunity. And so you are maybe considered probably more maximally protected than even people who've had just 2 doses of the vaccine and who were not infected. But even if you were infected, did get your 2 doses of vaccine, you should probably still go ahead and get that booster dose as well.
Your thoughts?
I agree. I really think that, when my child is eligible, he's 12 and he's about 6 months out from his most recent dose. We'll go ahead and get him boosted as soon as we can as well. So honestly, I'm all for it. Just go get the booster.
All right, a couple more questions. Donna wants to know, how long does Regeneron stay in your body?
Mm-hmm. So right now the recommendation is if you get the monoclonal antibody cocktails, again, it's Regeneron, Eli Lilly, and I think AstraZeneca just got an emergency use authorization for one of their formulations as well for pre-exposure prophylaxis. But the monoclonal antibodies, the answer is we typically recommend that you not get vaccinated for 90 days after getting that infusion of monoclonal antibodies. So it's about 90 days because, again, we just don't want it to interfere with any vaccine dosing.
Okay, so this is the last question. It's from Jill, and I want you both to weigh in on this. But we've been talking, you and Dr. Stites say a lot that outdoors is safe, certainly safer. But our outdoor events with really ginormous crowds that we see, NFL, but then you look at these college day events where everybody's so packed in there. I mean, packed to the gills, shoulder to shoulder, NFL games and pre-parties and all that kind of stuff. I want to know just how safe that is and what your concerns are. And then I'd like to ask you how that could affect numbers. I mean, we haven't really seen any big outbreaks, but it doesn't look super safe.
I know that we have seen some publications about events, most notably things like Sturgis and the big motorcycle rally, but a lot of that occurred indoors in the evenings in the bars and the restaurants. We know that there was the Provincetown data where a lot of people were vaccinated, there were spread, but again, there were a lot of indoor activities at that point. For the pure outdoor activities, such as tailgating, in which you are fairly spread out with other people. I mean, you're not crammed into a small enclosed area. For football games, things of that nature, they continue to tend to be very safe. We know that there were some publications from other one-time events like concerts, especially in Europe. I think they published a few cases about that with those big, large outdoor gatherings, and they didn't see necessarily a lot of spread during that because of the outdoor nature of that and the wind dynamics and things of that nature. But you can always try to maintain your distance from people in those types of environments a little bit more as well than compared to just maybe being in a stadium. In those seats, we know that there is those crowds, but again, I think with the outdoor the air dynamics and the wind and all that, you're fairly safe.
I know those Georgia football games look pretty packed. Do you cringe a little bit when you see that, Dr. Schmidtke? What do you think?
I do and I don't, because like Dr. Hawkinson was saying, the outdoor events, it doesn't seem fair, right? For those of us that have been, sheltering or
right.
avoiding crowds, it's like, what? Why do they get to do that? But honestly, being outside and being spaced out the way that is, it's okay.
And you hope people are vaccinated. So
yeah, of course I hope people are vaccinated. The reality is probably not quite 100%. But like Dr. Hawkinson also said, the danger really is what happens before and after that game or those events where people are going into bars and restaurants together. Those are really the high threat environments.
The close talking, all that good stuff. All right, let's do some final. The close talking, yeah. So let's get some final thoughts. Dr. Schmidtke, I'll let you kind of kick us off, head us into the weekend.
Yeah. So if you could, gentlemen, bring up my slide, my last one. Thank you. So I know there's this piece of disinformation that goes around sometimes where it's like 99.9% of people survive COVID. So don't stress about it, right? And maybe you don't even need a vaccine is one of the things that they'll say. And I just wanted to point out that that's only true for part of the population. So what we're looking at here is demographic data for the state of Kansas since the beginning of the pandemic. And what I want you to pay attention to is the row that says case fatality rate, and that's where the blue arrow is. And what you'll see is that the populations where that's true are children and adults 18 to 24. But as you move up in age, we start to depart pretty widely from that 99.9% thing. And of course, this whole thing ignores the reality of long COVID, which can happen and cause semi-permanent to permanent disability after infection. But if you're an 85-year-old, the chance of death is 19%. If you're a 75 to 84-year-old, it's 1 in 10. So that's higher numbers than I think a lot of us are comfortable with. If we look at the hospitalization rate, it can be very dramatic too. And with certain states starting to consider legislation where insurers will no longer be providing coverage for people that have chosen not to be vaccinated, I just don't think it's worth financial ruin to be afraid of the vaccine and not get it. So.
That's a hit between the eyes. Putting it to us straight. We appreciate it. Are you out of town next weekend?
No, I'm not.
Oh, good. Can you come back next Friday? I'm just going to ask you right here on the show.
Perhaps. I'll have to check my calendar.
I'm going to hit you up when we get off air. Dr. Hawkinson, give us some parting words today.
I think I had a couple corrections and addendums from yesterday. We had that. We addressed the boosters for 16 or 17-year-olds. We had that question from yesterday. We know a few hours later the FDA and CDC kind of started to endorse now boosters for everybody 16 and up for those Pfizer vaccines. Also, there was a question about a test dropout or a diagnostic test that would not pick up Omicron variant. I talked with Dr. Leisman, and our tests here, again, do because we have more targets for the virus that are unaffected by the Omicron changes. But there are tests out there that that have EUA approval that have only one target. There is a concern because of one of the mutations or deletions in Omicron that it doesn't pick it up. So there are those tests out there, so just be aware of what kind of PCR test you are getting. Omicron should not affect the antigen test, but for some of these PCRs it does. However, here again at the health system, we have 2 or 3 targets on our PCR test, so that does not affect our testing.
All right, thanks for that update, that question we had yesterday. All right, I have a final thought, and it's a reminder because we cannot remind you enough that blood supplies are alarmingly low here in the metro. Simply put, we need blood. We need your blood. The community blood center's blood supply stands at about a 1 to 2 day inventory. That is well below the ideal 7-day supply that is needed. There are 2 ways you can set up an appointment if you are eligible to donate, and most people are. You can schedule an appointment by calling the number there on your screen, or you can visit savealife.org and give the best gift you can this time of year. And again, thank you for being with us today. Don't forget you can catch our shows anytime on Facebook and YouTube. We will see you on Monday. We take you to a new space here at the health system to show you and tell you why it will make a huge difference for cancer patients and their families. These additional beds could not have come at a better time as COVID and flu cases add to the demand for care. This is a developing story that we are watching very closely. So please have the best weekend ever, and we will see you back here Monday at 8.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.